Hi, good morning, class. Welcome to Healthcare Information System subject. Uh, I hope you are in a good health and Selamat Hari Raya to all Muslim students. We're still in the Idul Fitri mode, but more or less we need to continue our subject and to complete it before week 13. Yeah. Okay. Today we want to discuss about the security in healthcare information system. Yeah. So what we will cover on this subject is you will learn about the importance of establishing a healthcare organization-wide security program. Maybe after this you can identify the significant threat, uh, either internal or external, intentional or unintentional, to the security of healthcare information system in a certain healthcare provider or organization. And then you will be able to give an example of administrative, physical, and technical security safeguard currently in use by healthcare organization, whether in Malaysia or in other country. And I think you can or you'll be able to discuss the impact and the risk of using wired or wireless network that allowing remote access to healthcare information system. Okay, I think this the last learning objective, wireless and wired. I think this is depend on the capability of certain country or certain healthcare provider, whether they still using a manual system or computerization system. And some of the healthcare provider, they don't use the wireless or wired. Some of them still use a standalone PC to manage the clinic and upkeep the health information system record. Okay, as an introduction, healthcare information system are the accumulation of paper and electronic patient data. So as more data is stored electronically, the need for security and confidentiality of patient information is increased. Yeah? So the use of electronic health record is increasing, and EHR or electronic health record provide a complete patient history. In Malaysia, we call it LHR, lifetime health record. So ensuring the privacy and security of electronic health information is a key challenge for organizations that collect, store, and exchange such information. As you can see that from the beginning, I gave you the lecture. So health information system is a computerization of healthcare provider processes from the manual to electronic. Yep. So from manual means all the health record of the patient, medical record of the patient will be uh, record in paper. Yeah, it's a paper base. So the doctor jot down all the clinical notes, clinical finding, test result, medications prescribed or consumption by the patient is all in the paper base. So the center of the patient medical record is based on the healthcare facility. What I mean is the information is located in a certain hospital or clinics, so it cannot be accessed anywhere. So if you want to access the record, so you have to go to the certain hospital or health clinic, enter into the hospital or clinic, and then you go to the medical record, and then you will you will need to search manually, yeah, by looking at the identification number or medical record number. It's a very tedious work or tedious process to get one patient health record. But compared to the electronic medical record, it's very easy to search a certain patient medical record by entering the ID or medical record number into the system. So the system will search for you, and a few seconds, all the uh, medical history of the patient can be accessed and can be viewed by the doctor or by the person interested on that. So you can see that when the things, the information is converted to electronic base, so the vulnerable of unauthorized person is open, yeah, is open now. uh, so any people can break down into the system, and then they can search the information very easy, yeah, through certain software via telecommunication, if the electronic medical record is put in the network storage. So this is one of the reason why some of the country, some of the hospital still reluctant to computerize the electronic uh, computerize the patient medical record into electronic medical record. So this is a barriers or reason why maybe why the healthcare information system or healthcare industry is step behind from other industry compared to banking or insurance industry. So security in healthcare information system or in healthcare industry is more on the privacy and confidentiality, yeah. So but I don't see that in Malaysia, for example, uh, we still lack of confidentiality practice, yeah. So yeah, of course, when you go to the hospital, there are they very restricted, they're very strict on the patient medical record. But when you check in detail, so the nurse and the health worker around the hospital easily open the folder of patient regarding the patient medical record. So anyone can see the diagnosis, the medication consumed by the patient, yeah, and then the tests conducted by the patient, examination conducted by the patient, uh, is very easy to see because they are not using a full electronic process, yeah. So and certain of the hospitals still use manual. I think 90%, 90% of the hospital or healthcare facility in Malaysia still use manual system. As like I give you a lecture, I think last lecture, when we bring you a case study in Malaysia. So a lot of healthcare facility in Malaysia are still using manual system. Manual system mean they use the uh, paper-based, yeah, paper-based, uh, uh, paper-based information to record the data, the tests, the drugs, the finding, all in the paper-based. So when the doctor pass the folder to the nurses, for example, so nurses can open it easily. Yeah? Then they can read the the information written by the doctor easily. So electronic medical record uh, is the future of the healthcare information system. EMR is a is a promise for efficiency of the uh, processes involved in healthcare services. Yeah. So without electronic medical record, the process will delay. For example, when uh, you want to visit the hospital, first thing that you need to do is you go to the registration department. Yeah. Last time when you hand in your IC number, so the registrar clerk will be searched manually and to get your medical record manually from the folder. There are a thousand of folder of the patient in the uh, rack, in the rack of the department. So it take time and then it affect the queue or waiting time of the patient. So compared to the hospital which use the computer system, a very few seconds you can finish your registration in the registration counter, and then they can send you to the specific uh, medical treatment, so you can see the doctor very fast. So this is a benefit of computerization of hospital, and electronic medical record promise a very huge benefit either to the healthcare provider as well as a patient, yeah, to get the healthcare services. So as you can see here, EMR are a system that will allow doctor and nurses to access data and give clarification to clinician performing the follow-up care, to whom a patient previous treatment or medical information is often needed. So electronic medical record promise a lot of benefit, yeah, and I don't think that for example, in Malaysia or in Arab country, in a poor country, so you cannot go back to the manual system. When you see that a lot of vulnerable in the system, or there are many threat in terms of the security. Uh, when we face this problem, is actually we need to resolve this problem. So the security or privacy or confidentiality of the information can be resolved through policy and also through software built in into the healthcare information system. Okay, electronic medical record got a lot of advantage. For example, provide a complete patient history, uh, increase patient safety, reduce medical error, improve quality of care, reduce cost. Example, decrease number of repeat testing, and also decrease fraud. Yeah. Okay. Provide a complete patient history means in healthcare, services. When the doctor start to diagnose your problems, so the patient history is very important for healthcare worker to view and study a little bit about your history. It's not about your personal history, but the history that related to your health. One of the important history that the doctor will ask the patient is regarding your previous problem. Maybe you got a serious procedure, maybe you got accident, you have steel in your iron in your body, yeah? Or you gone through a serious uh, operation on your heart, right? And they will ask you whether you got diabetic, asthmatic, and also your relative, your family history, medical history. The doctor also ask you about your father or your mother medical history. They will ask you about your father diseases, whether your father or your mother got diabetic or history about heart problems and etc. So this is very important to make sure that your problem in your health is regard to the genetic or regards to the lifestyle. Lifestyle means the way how you take your foods, your diet, uh, your social history, whether you are smoker or you are drinker, yeah, you are bisexual or you are homosexual. So this history is very important for the doctor to know and to predict what is your exact problem when you meet them, to diagnose uh, your diseases. So increased patient safety means reduce medical errors. When the hospital run the services without computer and a lot of transaction, a lot of instruction from the doctor to the specific clinical support. Example, doctor uh, send an order of test, yeah, or procedure to the lab or to radiology department or to pharmacy. If the clinical services department uh, wrongly understood about the instruction, so this might medical errors happen for the medical errors, such as if the doctor asked to do a test, a urine test, for example, and then when the order goes to the laboratory, so the laboratory is right or misunderstood about the instruction, or maybe they will do a HIV test, for example. So this is a medical error. So this will make serious medical errors. Another example is, let's say the doctor order or prescribe a paracetamol, for example, for the patient, yeah, and then the doctor write down 3 times with 100 milligram dosage, and then when the prescription received by the pharmacy errorly read the instruction, and then they dispense the drug to you with 300 milligram of dosage. So what happen if the patient take the drug with overdose dosage? so it will die. Yeah, it will die, and this is very serious medical errors. And this is happened in US. A lot of people die because of medical errors transaction compared to the real problem happen to the patient. Okay, another advantage I don't want to describe here. So of course, when you use electronic or computer, it will reduce the cost, improve the quality of care. Improve quality of care is in terms of speed, yeah, speed. So you or patient will not require to stay long in the hospital. You are not required to wait uh, long in the waiting room. So by I think within 30 minutes or within 1 hours, your process of getting the healthcare services is done. And then the rest of time you can utilize for other things. So this is very serious thing happen nowadays in the hospital. When you go to health center, such as in Aikro Polyclinic, yeah, try to visit every day. So how many patient waiting outside of the consultation room? So you try to clock in, and then you monitor one patient how long it should wait for one services, yeah, until they finish uh, and until they got the drugs in the pharmacy department, so you can clock it. Yeah. Same also in the Duran Tunggal Health Center. So you can see that a lot of patient. I've been there for once when I got a leg problems. So I need to wait half a day. Yeah. So my process uh, to get and see the doctor is until 1 p.m. Yeah. So I went to the hospital. Start from the registration is 9:30 or 9 a.m. and I finish my consultation until 1 p.m. So you can see that there are a lot of time we need to spend in the hospital to just get the paracetamol, for example. Yeah. Okay, electronic medical record disadvantage is a privacy and confidentiality concerns. Cost to implement EHR system and lack of standardization. So this is some disadvantage that I can list down here, yeah, based on the experience. So this is a concern, always concern by the health worker as well as the patient. But if we compare between Malaysia and developed country, privacy and confidentiality concern in Malaysia is very less. So you can see that in newspaper, yeah, or in electronic newspaper, if one of the VIP die, so they simply put that ABC die because of prostate cancer. ABD die is because of lung cancer. Okay, XYZ die is because of heart attack. So where is the confidentiality and privacy? So in hospital or doctor or health worker always said that, oh, the patient medical record is privacy, confidentiality. But in media, they disclose this information easily. So I don't understand that why this happened in Malaysia. But in developed country, they are very restrict on these things. Yeah. So the media cannot simply disclose uh, the problem of the person or patient in the newspaper about their health status. So when we implement the EMR, electronic medical record, so a certain policy, a certain uh, procedure should be embedded in the system. For example, yeah, we should have authentication. Authentication got a lot of elements. Yeah. For example, user ID and password. So the system challenge the user from entering the system. They will challenge the user to enter the right user ID and also the right password. So this is a common authentication. And then another level of authentication or security uh, is a role of the user. So not all the user can use the module available in the healthcare information system. So maybe the doctor can see all the patient information, or nurse only can see the uh, very basic information about the patient, or registration clerk only see the biodata of the patient only during the registration. So the system will not allow uh, the non-clinical worker to browse the patient information or patient medical record. Okay, another disadvantage is a cost to implement EHR system. So a lot of clinic or hospital or health center, uh, especially the government. I give an example in Malaysia. To implement the whole hospital with the EMR will take about billion ringgit Malaysia. Yeah. It's very expensive, but there are way how to reduce the cost. If the Ministry of Health want to hear from the research in Malaysia, especially in university, yeah. So they have a lot of research, and if that research output can be realized uh, in the hospital of Malaysia, so why not? So this is I think the Ministry of Health have to listen to the, or have to focus on the product which developed by the Malaysian, uh, rather than search and look at the foreign product. Yeah. So a cost to implement the EHR system is very high. Yes, I know. Uh, it's like other software project. So you need to do system development life cycle. So you need to go through a process by process. Yeah? And of course, the healthcare information system is very complex. And the system is very complex, so there are a lot of effort need to be done. Effort in terms of do a requirement, collect the requirement, understand the requirement, and transform the requirement into the system design. Yeah, design the user interface of the clinical information system. Uh, think about the user experience of health worker. So some of the doctor is very old fashioned. So they need the simple UI to enter the medical record of the patient. So we cannot simply develop the system according to the computer science experience. So you need to understand the health workers experience, and health workers requirement, especially on the UI and UX. Yeah. So make it the system simple, because the doctor uh, got a lot of thing to do with the patient. So if you design the system, it's very complex. So a lot of time of them spent on the computer rather than the patient. So you just imagine that one patient, uh, when they see the doctor, so they only have 10 minutes only. Yeah, there are a lot of patients outside waiting for them. So within 10 minutes, so you need to design the system is very robust and very simple to be used. And of course, uh, although the system is simple, but the data can be captured completely, yeah, to be keep in the database and for the future reference. And another disadvantage of electronic medical record to be implemented is a lack of standardization. So when the standard is not in place, not in place, so are very difficult uh, to integrate, yeah, between one department to another department, or between one application to another application, and very difficult to implement the security. So this is another disadvantage of EMR. So of course, and that's why I stress in the previous lecture, one chapter we discussed on the uh, term and coding, classification, and the standard. Yeah. So Hipaa, yeah. Is actually I don't want to bring this Hipaa in this slide, uh, but Hipaa is a very famous. Although Malaysia is not implement Hipaa, Hipaa is in the US, but I don't understand why Malaysian uh, doctor in Malaysia still talk about Hipaa. Yeah. So although they don't use a Hipaa, so they talk about Hipaa. So I just want to bring here to let you know what is Hipaa. When you talk with the uh, health ICT contractor or doctor or nurses about Hipaa, then you know about Hipaa. And it is not implemented in Malaysia. It is implemented in the US. So why I bring here is to get you understand. So the Hipaa is a policy. It's like a act procedure on health insurance portability and accountability. So this is like garis panduan, yeah. It's like what do I call it, a guideline, to protect the privacy and also the confidentiality and accountability of the healthcare information system implemented in the hospital. So this is uh, significant to the US, but I bring here to let you know about Hipaa. So Hipaa is like I said previously, Health Insurance Portability and Accountability Act. Uh, it developed in 1996, and all healthcare information system that implemented in US, so they they should obey this act. Yeah. So Hipaa is enacted to improve efficiency and efficacy of the healthcare system. Yeah. So when you want to implement or you want to computerize the hospital, so you have to comply with the Hipaa. So I don't know what kind of act in Malaysia. So last time when we developed the telemedicine, we have a telemedicine act in 1997. I think that Telemedicine Act is covered all the portability and accountability of the healthcare ICT that uh, could be implemented in the all healthcare provider in Malaysia, I think. So it designed to protect the freedom, security, privacy, and confidentiality of patient medical record. Yeah, protect personal record, diagnosis, treatment, progress, recommendation, radiology image, and lab result. So this is about the uh, accountability, yeah, and also the uh, security in terms of confidentiality and also the privacy of medical record of patient. Yeah. So when you got your job to involve in a project called Healthcare Information System. So when they talk about Hipaa, then it's not awkward by you. Yeah. So you know that what is Hipaa. Is it Hipaa is implemented in Malaysia? Where Hipaa is used? Yeah. So this is the information. So patient privacy, confidentiality concern. So when we implement the EMR, this is a concern by the patient and also the health worker. But from my observation, from my experience, the concern of privacy, patient privacy and confidentiality is come from the health worker only. It's not from the patient. So the patient doesn't care. If you want to see my health record, it's just uh, information about medication, about my disease and so on. Why is so serious? So we can share it in Facebook, in WhatsApp with our friends, yeah, in with our Facebook friend and so on. So I don't know why health worker are very concerned about the privacy and confidentiality. Uh, because maybe our rule is not straight. The media also very free uh, to disclose the VIP, or non-VIP or Mahrain community about their diseases. Yeah, yeah. So uh, anyway, when you involve in the computerization of healthcare information system, so you need to uh, put in the confidentiality and privacy uh, features in your system. So you make sure that when you develop a software, so you comply with the privacy and confidentiality features. So EMR use of wired or wireless network required increased security. So when you talk about EMR, uh, I think I need to put another non-network, another telecommunication or non-telecommunication. Yeah? EMR use non-telecommunication, wired or wireless network. Yeah, non-telecommunication means the standalone system. So they just run in one dedicated PC, yeah, or laptop. So of course, this is a requirement that common requirement, yeah, antivirus software, firewall. If you use wireless or wired uh, network, or your server is open to the public, to the internet, so you need a firewall installation. Yeah, so firewall will filter the unhappy unhappy threat. Yeah. So nowadays I think we are very busy with the news with our brothers and sisters in Palestine. Yeah. So we can see that Malaysia is one of among best security readiness in the world. Yeah. So number four. And then this is also a common requirement in any software, not only healthcare information system, is password. Yeah. And also the security code. Yeah. Password means user ID. You enter the user ID and then you enter the right password. Then the system allow you to enter into the system. And password also got a double security. So they will ask you to define your password with a strong protection. For example, use specific symbol with a hyphen, with uh, what they call it, capital letter, small letter, number, and so on, so that uh, the hacker very difficult to hack your password. Okay. Another security, common security element that you need to embed in your system is a security code. Security code means like when you want to uh, make internet transfer payment gateway, yeah, e-commerce. Let's say you want to buy something in Lazada, so you make online payment. So your bank will ask you to request the security code. They call it TAC code, right? And then you will get a few seconds. You will get the security code to enter in the transaction, in the specific transaction. So that called security code. Yeah. And then intrusion detection system, intrusion prevention system. So this is a more detail, yeah, about the security in the application. So you can put another level of security into your system. But I think in healthcare information system, the antivirus, firewall, password, security code is enough to protect the privacy and confidentiality of the patient record. So healthcare information system uh, is not involved dollar and cent, yeah. But you must bear in mind that nowadays the biology war or biology weapon is very common now. So some of the country are very interested on the some of the country health status. So from the health status of the country, so they can do something, yeah. Or maybe they can block the drug, yeah, to be export to the certain country, yeah. So this is a war game, yeah, across the world. So the health status of certain country is very important. So you can attack certain country by knowing that the health status of the country. So let's say now India suffer with COVID-19. Yeah, everybody know that the India now is very serious with COVID-19. A lot of people die because of COVID-19. Let's say we stop uh, the what they call it, uh, the drug to be protect the COVID-19 to India. So the COVID-19 virus will be increased seriously. Yeah. So Patient privacy, confidentiality concern requires a backup system for power outage or disaster recovery. So this is another, I think, although this is a legacy way how to protect the data, but the backup system is very very important. Yeah, although you got the cloud system nowadays, a cloud system can do everything for you, but more or less you need to do a offsite backup. Yeah, so you need to do your own backup. So we cannot trust 100% on the cloud or in or automatic backup on the net. Yeah, so you need to backup offline. Yeah, so you have to backup in other media, for example, in your thumb drive or in the cassette, tape, CD, DVD, and etc. So that anything happen, let's say earthquake happen, so you have a backup. Yeah. So backup can be done uh, whether daily or weekly, monthly or yearly. Yeah. So I advise that you need to do a daily backup, so that you are in the safe mode or safe status when something happen. Yeah. You just imagine that now Israel attacked Palestine. So a lot of building collapse. Yeah. So what happened to the data, yeah, run in certain business, for example, or banking system, bank building is collapsed. Then there are a lot of information uh, destroyed. So where we want to get this information? So if we don't have a offsite backup, yeah. Okay, way to increase security. So there is no way to increase the security instead of education. Yeah. So we need to educate the user uh, how to uh, how to make sure that the data is secure, the data is confidential, and data is privacy, and can be backup or can be available almost the time when the disaster happen. Yeah. So the education is very important. Not only the user in the organization, uh, the public user also need to educate. Yeah. Yesterday I got the message from the university. So because Israel now declare war to three countries that support the Hamas activity. They claim uh, one of the country is Malaysia. Yeah? Malaysia, Qatar, and Turkey. So now Malaysia government get ready any threat from the Israel. Yeah, especially on the net. Yeah, on the net, on the internet. So a lot of news said that a Malaysian hacker uh, successfully hacked the Israel website. Yeah? So I don't think that they are not silent, or they just still sleep. So they will encounter back, yeah, uh, to our system. So if we are not ready, so there are a lot of procedure and policy that draft by the University of Government Hospital, our government to protect our internet, to protect our data, computer, so that all our works can be safe accordingly. Yeah. So this is one of the education, education initiative. Yeah, initiative. So another ways is enforce privacy rule. So you see, when you have an account in Sistem Maklumat Pelajar SMP, every month they will enforce you to change the password, right? That is a privacy rule. So enforce the consumer control, setting boundaries, accountability, public responsibility, and also release information for public and national health, right, and the security. So enforce means that if you don't follow that, they will enforce you to uh, log out your computer. Yeah, if you don't use your computer, and then you open your system without using, maybe in certain time, so they enforce to log off. Yeah, you can see that session is out, time out. That is a enforced rule, yeah? Automatically done by the computer. So another way to increase security is a privacy screen or computers. Maybe the user is advised to blur their screen, especially the doctor or bankers. Uh, the doctor, for example, they need to blur the screen to avoid the nurse to see the patient information. Yeah? Encryption, yeah? Scramble text to a key, and of course the authentication. Yeah? We can use fingerprint, palm scan, retinal, voice recognition. Okay, this is a technology available in the market. Yeah? Whether we want to use or not, or this authentication type is relevant or not, is depend on the budget of the healthcare provider, or it is significant to be used. Yeah. Okay, issue with security method. Yeah. Authentication issue, protective clothing such as glove, mask, and goggles are often used, which can hinder access to scanning. So this in the healthcare industry. Yeah. So you can see that the doctor will use a glove, mask, or Google. So when we want to use, for example, fingerprint or palm scan or retinal scan, this technology of security uh, can be an issues. So the scanner cannot read the Google, cannot read the mask, cannot read the glove. So this is a problem. Dirt and blood can decrease biometric scanner reliability. Yeah, of course, the doctor, they every day play with the blood, yeah, and dirt, nurse with the dirt. And when you use a thumbprint, so of course the thumbprint cannot read your hand or your finger, the doctor finger with the blood and the dirt. And it is not fail proof. Issues with security method using smart card and password. Maybe a smart card is lost, and password can be forgot or hacked. Or of course, yeah, health worker, especially the doctor, their thinking is about the patients. Yeah, there are a lot of thinking about the diseases or the drug and so on. So maybe the password is forgot, especially the doctor, uh, the aging doctor. Yeah. I also cannot remember my password for a long time. Yeah. So when health worker want to use the system, so they need to send the forgot password, uh, and then read the email. Okay, click the link, change the password, and then when they change the password, very simple password, so the health worker uh, is warning by the computer, asked to change another password. So this take time. Okay? That become issue. So as a computer software, so you need to resolve this thing. Although we want to secure the system, but you need to simplify the process, how to change the password easily. Yeah. So I got this experience with the sistem maklumat belajar and sistem maklumat pekerja in UTM. Yeah. When we forgot the password, so it take one day to resolve the password issue. So this is not good. So it's wasting my time, wasting a lot of people time. Okay, in summary, electronic health record are on the rise and has both advantage and disadvantage. So, but I can say that electronic health record is got more advantage than disadvantage. So, compliance with Hipaa is necessary for SRS to protect patient confidentiality. So, this is related to US. So, in Malaysia, I think compliance with Tele-Malaysian Act, for example, is necessary. Or any act that developed by government of Malaysia or government of other country, for example, in Bangladesh country, or in Yemen country, Nigeria country, so they have their own policy. Yeah. So follow the policy. So many ways to increase security through education, antivirus, or firewall, password. So this is technology. Yeah. Through education and also the technology such as antivirus, firewall, password, and authentication technology. So I think that's it for security in healthcare. Uh, More or less is the same with other application, other industry, but you need to go inside the process of healthcare services. Like I said just now, what happened if the doctor that busy with glove, mask, or Google, and dirt with blood. Yeah. So how the biometric scanner can read or can resolve this issue easily. Yeah. Okay, class. That's it for this chapter 10. I hope you understand. I hope you can apply the security requirement to your projects. At least you got the authentication features, which is user ID and password. So try to implement in your project, and then I hope your project is progress accordingly. Yeah. And now we are in the week 10. So you got another 3 week only to finish your projects. Yeah? Okay, that's it. Thank you very much, and assalamualaikum.